Joining us today. Good afternoon. As always, we are joined today by our Public Health Commissioner, Dr. Mendoza. I just want to say my message today is going to be short. It's not that much different than what we said yesterday, and it's not much different than what we've been saying for the last several weeks, but it is going to be said with a little bit more urgency. We are having a problem here in Monroe County with increasing COVID-19 numbers and our increasing positivity rate. The increase in the positivity rate can be tied to indoor gatherings with groups of people who are not wearing masks, are not keeping 6 feet of physical distance between them. And it's whether it's at home or it's out at an establishment like a bar or restaurant, or it's elsewhere. We need to be smart. We need to learn understand what we've learned from earlier this year. We need to learn from mistakes. We need to learn what worked right and what went well, and we need to react. And we need to do that as a community to prevent our numbers from growing even higher. Earlier today, we saw Governor Cuomo's press conference that we're on the radar of New York State. New York State's growing concern, just like we have been, at the increasing positivity rate that we're seeing in Monroe County and what we're seeing across really the Finger Lakes region and across parts of Western New York. So I want to address a few things that were talked about in that press conference today, but then also chart out where we're going to be in the path forward. I've been in constant communication with the governor's office throughout the pandemic. I spoke to them earlier today. Also spoke to my counterpart in Erie County to talk about what the experience is in other parts of Western New York. Over the next several days, we will devise a strategy to help us understand how we can start to slow the spread here at home and across the region to make sure that we get to a place where our numbers start going down. I want to touch a little on the micro cluster strategy. It was announced last month and would be implemented by the state, but in the goal of the micro cluster strategy is to detect outbreaks and taking quick action to eliminate them and then bring them back down. With the strategy, with the cluster strategy, there are 3 zones. There's the yellow, orange, and red cluster zone. A zone can be as small as a zip code or a census tract. It could also be a town. It could be a city. It could be a county. It could be a region. The color designation relates to the positivity rate in the geographic area. Yellow designation is a 7-day rolling average positivity above 3% for 10 days. An orange designation is a 7-day rolling average positivity above 4% for 10 days. And red is a 7-day rolling average positivity rate above 5% for 10 days. Depending on the zone designation and how severe the spread is, there are restrictions that can then be put in place until that positivity rate starts to come down. In the yellow designation, an example of a change that could be made is the reduction of a capacity. It could reduce from 50 to 25, the maximum number of people who can be gathered indoors or outdoors and things of that nature. And you start to go through different phases of restriction to help minimize and avoid the spread. To put into context how that relates to our numbers, the regional control room tracks the positivity rates in the region, but then also in the counties. On November 1st, our positivity rate for Monroe County through the regional control room was 2.05. On November 2nd, it was 2.08. On the 3rd, it was 2.27. And on the 4th, it was 2.73. Obviously, the numbers are continuing to increase. Our number of cases yesterday was high, and I'll have Dr. Mendoza talk about the number of new cases that are being announced today. So this is the data that we're looking at, and this is the data that the state and our health department uses as we work together to determine what our next steps should be and what our recommendation to the public should be. It should be noted, as of right now, we do not have a designated cluster in Monroe County. We have taken the education of first approach strategy that I think has worked very well going back earlier into the year and as we went into the summer months and now we're into the fall. But what we're seeing is what we refer to as COVID fatigue. And I'm very concerned about what that means over the next several weeks and several months. Earlier this year, we learned lessons. We learned how to wear masks. We learned how to stay 6 feet apart from folks. We learned how to not just engage in social distancing, but what we think of as physical distancing, to keep that distance apart to minimize the spread. As the weather got nicer, we started to come back together again in groups and see our friends and family. We did so outdoors. We did so with masks. We did so spreading apart. And now as the weather is turning, what we're seeing is that those gatherings that were outdoors with physical distance, those gatherings are starting to move indoors. And when you have a positive test, it's not unusual, and I'll have Dr. Mendoza talk about this. It is not unusual when you have a positive test, when the contact tracer calls someone, they indicate that last weekend they were at somebody's house, a friend's house with 10 or 15 other people. Nobody was wearing a mask, and now many of those people are turning up sick. That's the type of spread we need to learn how to avoid. How do we avoid those spreads? It's by wearing a mask. It's by it's by remembering what we learned earlier this year. We wear a mask, we keep a distance, and we use hand sanitizer, and we stay safe. If we continue to do that, we're going to be okay. And we're going to get through this together. And, you know, I look at it this way. What we do today will inform what this community, the health and safety of this community looks like 3 or 4 weeks from now. So the steps that you take this weekend to wear a mask, the steps that we take to keep the 6-foot distance, the steps that we take this weekend to reduce the spread in this community will directly relate to what the community health looks like as we get into Thanksgiving. So we really need to double down on that strategy. We need to also remember what worked earlier this year in terms of helping our neighbors and calling our community into action. If you have an elderly neighbor who really should not go to a grocery store and be exposed, reach out to your neighbor and ask if you can help with their grocery shopping. If you know somebody who does not have access to a mask and you do, share your mask, get them access to a mask. We need to start to learn again how to help our community get through this, how to learn the lessons or remember the lessons that we learned from before. And we're going to get through this together as a community. But now is really the time to not give in to COVID fatigue, but to double down on the efforts that we know work and reduce our positivity rate so that we continue going in the direction that we've been going all year, which is to lower the curve and keep the curve as flat as possible. So now I'll turn over to Dr. Mendoza, and he could talk a little bit about what the numbers look like today and what they're learning through their contact tracing.
Thank you, County Executive Bello, and as always, thank you to our partners in the media for being with us today on such short notice. The County Executive referred to pandemic fatigue, and I will go one step further and call it pandemic apathy. I am concerned that people are sick and tired of being sick and tired and are not interested and not listening to these recommendations. This is an important time for us. We need to take these recommendations seriously because the numbers now show that we have not done a good enough job at following all of these precautions. I'm concerned about the positivity rates that the county executive mentioned, not only because it is up to 2.73% as of yesterday, but more so because of the rate of increase. It is increasing at a much higher rate than I'm comfortable with. My concern is that we are heading toward a slippery slope that will be very hard to turn back from. So not only is the transmission higher now, the positivity rate is higher now, but we're also looking at a lot more cases. Today's number will be 174. We will be looking at 174 cases reported today, and I am confident that tomorrow will be higher. This is the result of more prevalence of COVID-19 in the community. This is not simply a result of more testing. It is true that we are testing more, but a greater proportion of the tests that we are doing are coming back positive. We are seeing very, very clearly in our contact tracing a very concerning pattern of a lot of small or large gatherings that are happening typically in private settings, in people's homes, their dorm rooms, and their apartments. We are seeing a large number of Halloween-related gatherings. Nothing related to trick-or-treating that we can tell, but these are typically gatherings of people in their 18 to 22-year-old range who have gathered outside of trick-or-treating, have gathered privately indoors, and have not been wearing their masks. We're also seeing a larger number of sports-related gatherings. These aren't the sports themselves. This isn't playing on the field, but it's getting together before or after a game, before or after a practice. Again, it's the gatherings that are bringing people together. And finally, we're also seeing a small but concerning number of people who are going to work while sick, going to work while under isolation. It may be that there is some confusion here, and we want to clarify that. But my greater concern is that people are just disregarding the fact that they have symptoms, or disregarding that they are under isolation orders and are going to work anyway. So the plan going forward is that we are increasing our staffing here in the health department to keep up with these numbers. I've been in touch with my colleagues across the state. We've been in touch with the Western region, Erie County, and my counterpart there, Dr. Burstein. We're all encountering very similar patterns, and we will be working very hard through the weekend to keep up. But my one and only message to the community is, please take these precautions very seriously. This is not the time to give in to apathy. Thank you.
Okay, we're going to open it up to questions from reporters. First up is Kyla Green from WROC.
Hi, good afternoon. I'm just wondering if there is any possibility in the near future that people should know about another shutdown. I know the governor said that there'll be new plans emerging Monday. Do you have any indication that that could be another shutdown of any kind?
We have not had a conversation about shutdown. It's something we're looking to avoid. And that's why we're having, we're talking to the media and the public today. That's why we've been doing these regular exercises, is that in communication, is that we really are asking for the community's participation, because whether or not there goes to another type of shutdown, or we go back through the phases the other way, is all dependent on how the community responds to what Dr. Mendoza just laid out. The cases that are coming from those large family, not necessarily family gatherings, but those large gatherings at people's houses, at their residence, or you're looking at Halloween or sports teams, things like that. You're seeing large spreads. We're also seeing it in the businesses, not that it's spreading from a business to a customer, but what we're seeing is, within a business location, there's a break room. And people are starting to take off their masks. They're sitting all together in a cafeteria, eating lunch, all in close proximity, no masks, going back on what we know works, and then they all become sick. The goal is always, remember, to keep this away from the population where they could have the most negative impact from the illness. So folks who are elderly, and people who are otherwise immune compromised. So right now we don't have that. But we're heading in the wrong direction. Dr. Mendoza said it very clearly, that he does not like the direction of the way our numbers are. I'm an optimist. I think, we rallied together as a community earlier this year when our numbers were going up and the hospitalizations were going up. We rallied together and we flattened that curve. I'm optimistic we can do it again, but it's going to take cooperation and buy-in from everyone in the county.
Okay, next up is Randy Gorman from WXXI.
Hi, gentlemen. Thanks for taking the time today. Adam, I know you just talked about wanting to avoid a shutdown. I was on the call with the governor and the other reporters today, and in fact, in the press release he sent out a little while ago, he basically said, the microcluster strategy is something that he thinks is appropriate. I know he's talking to you and other officials over the weekend, but even if it's that very targeted situation, are you worried about what this will do from an economic standpoint if some businesses have to pull back in some way, shut down, whatever is decided?
Oh yeah, of course I am. Yeah, there's gonna, when there's a shutdown, there's an economic consequence, and it's, an economic consequence. Though, remember, this isn't just about, when you have businesses that are open and they have to close, right? That's about the employees getting a paycheck. That's about the business owner and their livelihood and their it could be a family business. This is their life that's being impacted all across the community. So we have a responsibility to each other to try to avoid that as much as possible. We have a responsibility. I have a responsibility to wear my mask when I leave the building today, so that small business owner can stay open 3 weeks from now, right? I have a responsibility, and everybody at home has a responsibility to wear their mask when they go to Wegmans, so Wegmans can continue to stay open, right? We all have that. That's our responsibility as a member of the community to do what it takes to protect everybody, even if you don't believe in it, right? Even if you don't believe in the efficacy of a mask, you still have a responsibility to wear one when you go out into the public, because it's not always about you, right? It's not always about me. If I got sick, I'd probably be okay, right? I'm in general health and good health, and I'll probably be fine. My family would probably be fine. But if I spread it to my parents or my in-laws or my grandmother, that could be a problem. And so we really need to understand that our actions are about affecting other people.
But you are prepared for the possibility there will be some microclusters declared, though, right?
Oh, sure. Yeah. When we'll have the conversation this weekend, we're always prepared. We're always prepared for that. But, you know, my job as a community leader is to try to rally this community around the common good and what the cause is. And right now, the cause is protecting each other. And I think that the better we can do doing that, the less chance there would be of any type of shutdown. You know, the cluster strategy, if you look at the cluster strategy, you know, if you're a yellow zone, it really, what it does is it starts by reducing capacity size, is the real big first key to that. So that capacity goes down to 25 people for an indoor-outdoor gathering instead of 50 people, which it is now. So it's there. You're first in the cluster strategy. You first start to see things like that. But you know, we'll have those conversations over the weekend on where those numbers go. But I really would, you know, I think everybody in the community can agree we'd like to avoid a shutdown. And to do that, we have to follow the regulations. The other thing I just wanted to mention too, back to the previous question, is, you know, when it comes to testing, we New York State has set up a testing apparatus. I talk about it every time at every press conference at MCC. It is really easy to get a COVID-19 test in Monroe County. If you go to our website at monroecounty.gov, the hotline is there. You can also link to the state website to sign up for your test, sign up for an appointment. They can do 700 tests a day. They've done 80,000 tests at that location over the last several months. And you can get a test there. It's free of charge, whether you're symptomatic or not. If you think you've been in contact with somebody, if you were at a party, you're not sure what happened, go get a test. You can sign up today and likely get an appointment in just the next couple of days. And it's a relatively quick turnaround with the result. And that's another way that you can engage and be a good citizen as we go through the pandemic and try to flatten the curve, is to get a test, because the more people we test, the more cases we can find, and it will allow Dr. Mendoza and his contact tracers to then do their work and their job in getting that person isolated and then figuring out who they've come in contact with and isolating them as well. That's what worked earlier this year.
Thanks.
Thanks, Randy. Next up is Jennifer Lukey from WHEC.
Hi, guys. I have asked this question on multiple press conferences, but I want to circle back. The governor said today, quote, "You would have to be living in a cave for the past 9 months to not know what the rules are. You have been preaching education over enforcement, but obviously it's not working. So when do you step up enforcement?"
Well, Jennifer, that's what this conversation is about in terms of limiting and going back to whether or not we have to be in a cluster, which then changes what those rules are. We do enforcement. The county health department engages in enforcement. I'll let Dr. Mendoza talk about that all the time. And we're in touch with businesses all the time when we get, if a question comes in or a complaint comes in. So, you know, enforcement looks different ways. In our case, we start with education. If that doesn't work, then there's a series of steps that can be taken up to fining or closing at the end of the day. So those activities we engage in all the time. I'll let Dr. Mendoza talk about what that looks like, but it's always done through education first to make sure everyone's doing the right thing.
Indeed. Our plan with restaurants, to give an example, is if we are made aware of or we discover a violation of some kind in a food service establishment, our first approach is always correction and education. And as many of you know, we will make an unannounced visit subsequent to that initial to ensure that the concern was rectified. If it was not rectified at that time, then we will issue a citation or a fine. And then we have a process for hearing before the Board of Health that will then implement whatever penalty is permitted by the law. And that is the policy, that is the procedure that we would follow here. My intention in the next few days is to be reaching out very directly to restaurants and as many of the businesses that we can reach in this community directly to, again, make them aware of how far we've come. We've done a very good job so far, but we have a long way to go. And I think everybody has to step up and play their part. We issue that initial education. There will not be an excuse for not knowing what the consequences are following that. And then if we are made aware of concerns, we will investigate them and then take the next steps. But at this point,
just to clarify, there has been no COVID-related fines to date in Monroe County.
That's correct.
And just one follow-up question, and this might be for the county executive. The governor's rules say that movie theaters have to close when we reach 2%. We know that some of them are voluntarily doing that. Have you received guidance on whether that needs to happen immediately?
I have not, but that will be part of the conversation this weekend.
Okay, thanks, Jennifer. Next up is Jeremy Mole from City News.
Sorry, Jeremy, I don't think we can hear you.
Sorry, I forgot to unmute myself. We had heard that Highland Hospital has had some level of an outbreak among staff, like maybe 20 cases. Is this something that you guys are aware of?
Yes, I was made aware of that, I think, last weekend now. And I've been working closely with my colleagues at Highland Hospital on this. I was present for a number of their town hall forums, which earlier this week, I think. And they made the message very loud and clear to their staff. And I will make that message to the community. We as healthcare workers need to hold ourselves very responsible for our own health and our own behavior, because not only do we set a role model, an example for the community, but we also need to stay healthy to keep our patients healthy. So to all of my colleagues in healthcare that are listening today, we need to hold ourselves to a higher standard.
Okay, thanks, Jeremy. Next up is Tyler Brown from 13 WAM.
Hello, can you guys hear me?
Yes, how are you?
Okay, good, how are you?
Great.
All right, so my first question, obviously, Governor Cuomo mentioned the fact that he feels like, we should he feels like county should, have more law enforcement involved in the actual enforcement of this. Are you guys in communication with law enforcement in terms of how you're enforcing in terms of these gatherings outside and inside public places? And will there be any changes to how law enforcement will enforce these rules now that we're seeing such a spike?
Yeah, we are in touch. We've been working very closely with the sheriff this year, going right back to the start of the pandemic, in law enforcement across the county. Enforcement in terms of, like different establishments like a restaurant or bar, that really comes down to the health department is the first response. Dr. Mendoza laid out what the plan is there and the strategy. When it comes to outdoor gatherings, sure. Law enforcement from the beginning have been partners in trying to educate people when they see large gatherings, things like that, and try to make sure people understand the risks involved. So we'll continue, obviously, that level of partnership.
Thanks, Tyler. Next up is Andrew Freeman from Spectrum News.
Well, I guess actually, sorry. My first question is just this weekend, the governor said that you guys will be talking. Do you anticipate what that conversation will entail and what things specifically might be discussed?
Sure. Well, I'll tell you from my perspective. I mean, this is what we've been discussing, what's been happening with our numbers for weeks now, we've seen this trend. We started doing weekly press conferences just a couple of weeks ago because we saw the trends heading in the wrong direction. I mean, we've been in the right direction for an awful long time. It wasn't that long ago that that our county and the region here was one of the lowest. Or I think it was our county had the lowest infection rate, I think, in the country. That was just a few short weeks ago. And in the next short weeks from there, we started seeing some spikes going up, and the numbers just routinely going up and up and up. So we've been concerned about this for quite some time. That's why I said at the onset here, my message today is not really different than it's been over the last couple of weeks, but the urgency is there. And what I expect the conversation to be about is how is it spreading, and what are the actions that we can take to mitigate that? That's my expectation. From the beginning, the response to the pandemic has been regional in approach, it's been local in approach, to be able to identify what is the problem that exists in each community so that we can develop the right strategy to address it. In Monroe County, our strategy that has been working right up from the beginning largely has been education. It's been the community being involved and bringing people together. And I think that's worked. It's worked really well. I think we've set into COVID fatigue. I think we're getting tired of that. We're getting tired of the messages. We're getting tired of wearing a mask. Trust me, I don't want to wear this mask either, right? We're getting tired of it. But we need to come back together as a community and have that conversation again about doing that. We have to make sure that we're going back to what worked earlier this year. And so I think the conversation that we'll be having with the state over the next several weeks, the conversation I have with my counterparts, Dr. Mendoza spoke to his counterpart today in other counties. I spoke to my counterpart today as well in Erie County. We always talk, we always share what's going on in the communities. This looks a little bit different though than it did earlier this year. Earlier this year, we had a lot of folks in those high-risk categories becoming sick. Here, this curve is starting with younger people, and we're seeing it amongst younger people. It's spreading quicker. Our positivity rate is going up, but we are, make no mistake, seeing that increase in the hospitalizations as well. So we have to understand exactly how that's spreading, and then how can we galvanize the community to come together and solve this problem together, right? No problem is insurmountable, but we can all do this together if we learn the lessons of the past, and we all understand that the actions that we take aren't a selfish action for ourselves, but it's a community action that's going to help our neighbors.
Thank you.
Last questions for Brian Sharp from the Democrat and Chronicle.
I was just wondering, the governor talked also about airports today. I was wondering if you could talk a little bit about how you're going to be handling the situation at the airport. You've got students coming home here in a couple of weeks that'll be flying in. I've heard from parents who want to know, well, how do I get my kid home? What are you going to be doing at the airport, and how are you going to be helping folks? What advice would you give to parents?
So a couple things. So first, the New York State Department of Health has been managing the operation at the airports here in Monroe County, and I know the other large counties upstate. The advice, though, that I would give to parents is this, is that you have to take this seriously. The governor announced new travel requirements that requires a test before you travel, and then a test, I think, once you arrive within so many days. That's why I keep stressing the testing at places like MCC, because testing here, I can't speak for what it's like in other states or, college towns across the country where you're coming from, but testing here has never been easier. You really just have to call the hotline. You get a test the next day, and in some cases you can get your result, 36, 48 hours. Sometimes it can take 3 or 4 days, but you can get a test result back pretty quickly. So it's very easy to do. So my advice is this: wherever your student is coming from, if they're coming home for Thanksgiving from college or wherever it's from, have them take a test from where it is they're coming from, and then when they get to Rochester, immediately call that number. You could probably actually call that number before they travel back to Rochester and get the test scheduled, because you don't just show up at the site, it's a scheduled test. So I would recommend, if you're coming back home for the holidays, you're a college student, call the number, go to the website, schedule that test for your arrival here, and then and get that COVID-19 test.
Okay, that's it for everybody. Thank you.
All right, thank you, everybody.
Thanks.
Are we out? Nope.